Hello, this is Dr. Ade again, and this is a third part of our topic on polycystic ovarian syndrome. And I personally think this is probably the most important part of the discussion. And because polycystic ovaries or polycystic ovarian syndrome is associated with diabetes, it's associated with an increased risk of cardiovascular disease, it's associated with an increased risk of raised cholesterol, especially the bad cholesterol and low good cholesterol. You can imagine that is associated with a lot of medical problems, so it's not just about infrequent or irregular or no periods or not conceiving. No, there's a lot more to it, and thus the management should actually be quite, I wouldn't say aggressive, but quite active. It should be quite active. So you have to get involved in your own management with this condition because you're used to this syndrome. It's become an everyday condition for you. You don't feel as if there's anything wrong, but there's an increased risk of these major medical problems that you're carrying around on a day-to-day basis. So when I say lifestyle changes, I want you to be aware of why we advise lifestyle changes. It's not just about the weight. The problem with the weight is it gives us insulin resistance, and insulin resistance generally leads to diabetes, type 2 diabetes, which in itself has its own problems, as does cardiovascular disease, which in itself, as you know, has its own problems with us here in England. Also, we have raised cholesterol, which also can lead to cardiovascular disease, which you've discussed as one of the topics we've discussed before, if you want to look back on that one. So I would say lifestyle changes cannot be overemphasized. The use of metformin, apart from helping ovulation, also helps in treating the insulin resistance. So if you are giving metformin and you start having regular periods, do not stop it. You don't stop it because there are other things it's dealing with. You must speak to your GP. So I just wanted to come back and discuss all these metabolic changes with you so you know the significance of polycystic ovarian syndrome. Thank you very much. If you have any questions, please let me know. Thank you. Bye-bye.